Get out of my stuff. Thank you.
Sorry about that. Okay, I'm doing this video over again because I tried to download it already and it just didn't want to do it, so I'm redoing the video. This is bipolar 2 criteria. Alright, here we go. Bipolar 2 disorder. For a diagnosis of bipolar 2 disorder, it is necessary to meet the following criteria for a current or past hypomanic episode and the following criteria for a current or past major depressive episode. Hypomanic episode. A distinct period of abnormally and persistently elevated, expansive, or irritable mood, and abnormally and persistently increased activity or energy, lasting at least 4 consecutive days and present most of the day, nearly every day. Excuse me. B. During the period of mood disturbance and increased energy and activity, 3 or more of the following symptoms have persisted. 4 if the mood is only irritable, represent a noticeable change from usual behavior, and have been present to a significant degree. All right, so here are the symptoms. 1. Inflated self-esteem or grandiosity. 2. Decreased need for sleep. Example, feels rested after only 3 hours of sleep. 3. More talkative than usual or pressure to keep talking. 4. Flight of ideas or subjective experience that thoughts are racing. 5. Distractibility, i.e. attention too easily drawn to unimportant or irrelevant external stimuli, as reported or observed. 6. Increase in goal-directed activity, either socially, at work or school, or sexually, or psychomotor agitation. 7. Excessive involvement in activities that have a high potential for painful consequences. Example, engaging in unrestrained buying sprees, sexual indiscretions, or foolish business investments. C. The episode is associated with an unequivocal change in functioning that is uncharacteristic of the individual when not symptomatic. D. The disturbance in mood and the change in functioning are observable by others. E. The episode is not severe enough to cause marked impairment in social or occupational functioning, or to necessitate hospitalization. If there are psychotic features, the episode is by definition manic. F. The episode is not attributable to the physiological effects of a substance. Example, a drug of abuse, a medication, or other treatment. Note, a fully hypomanic episode that emerges during antidepressant treatment, example, medication, ECT, but persists at a fully syndromal level beyond the physiological effect of that treatment, is sufficient evidence for a hypomanic episode diagnosis. However, caution is indicated so that 1 or 2 symptoms, particularly increased irritability, edginess, or agitation following antidepressant use, are not taken as sufficient for diagnosis of a hypomanic episode, nor necessarily indicative of a bipolar diathesis. Major depressive episode. A. 5 or more of the following symptoms have been present during the same 2-week period and represent a change from previous functioning. At least one of the symptoms is either 1. Depressed mood, or 2. Loss of interest or pleasure. Note, do not include symptoms that are clearly attributable to a medical condition. 1. Depressed mood most of the day, nearly every day, as indicated by either subjective report. Example, feels sad, empty, or hopeless, or observation made by others. Example, appears tearful. Note, in children and adolescents can be irritable mood. 2. Markedly diminished interest or pleasure in all, or almost all, activities most of the day, nearly every day, as indicated by either subjective account or observation. 3. Significant weight loss when not dieting or weight gain. Example, a change of more than 5% of body weight in a month, or decrease or increase in appetite nearly every day. In children, consider failure to make expected weight gain. 4. Insomnia or hypersomnia nearly every day. 5. Psychomotor agitation or retardation nearly every day, observable by others, not merely subjective feelings of restlessness or being slowed down. 6. Fatigue or loss of energy nearly every day. 7. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being sick. 8. Diminished ability to think or concentrate or indecisiveness nearly every day, either by subjective account or as observed by others. 9. Recurrent thoughts of death, not just fear of dying, recurrent suicidal ideation without a specific plan, a suicide attempt, or a specific plan for committing suicide. B. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. C. The episode is not attributable to the physiological effects of a substance or another medical condition. Note, criteria A through C constitute a major depressive episode. Note, responses to a significant loss, example bereavement, financial ruin, loss from a natural disaster, a serious medical illness or disability, may include the feelings of intense sadness, rumination about the loss, insomnia, poor appetite, and weight loss noted in criterion A, which may resemble a depressive episode. Although such symptoms may be understandable or considered appropriate to the loss of the presence of a major depressive episode, in addition to the normal response to a significant loss, should be carefully considered. This decision inevitably requires the exercise of clinical judgment based on the individual's history and the cultural norms for the expression of distress in the context of loss. Bipolar II disorder. A. Criteria have been met for at least one hypomanic episode, criteria A through F under hypomanic episode, and at least one major depressive episode, criteria A through C under major depressive episode. B. There has never been a manic episode. C. The occurrence of the hypomanic episode or episodes and major depressive episode or episodes is not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified or unspecified schizophrenia spectrum and other psychotic disorder. D. The symptoms of depression or the unpredictability caused by frequent alternation between periods of depression and hypomania causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So that is bipolar II criteria in the DSM-5. And hopefully this will download this time. All right. I hope this was helpful to you guys. I'll see you soon. All right. Take care, guys. Bye.